two major health systems with her son, who is a pediatric cancer survivor. Elise has developed and presented in services on PFCC to employees and students throughout the Memorial Healthcare System. In 2019, Elise was awarded the Florida Hospital Association Service Award for her volunteer work at the hospital. She has presented at national and international conferences on patient and family-centered care and health professional education. While teaching at Florida International University, or FIU, she was a founding member of the College of Medicine, College of Nursing and Health Sciences Interprofessional Education Committee, where she successfully advocated for family representation and input for educational workshops. While at FIU, she assisted in the development and presentation of their annual IPE workshop for over 500 medical and allied health students. For the past 5 years, Elise has been a faculty member of the Occupational Therapy Department at Nova Southeastern University, where she works with doctoral students interested in patient and family-centered care research. Elise serves as chair of the College Interprofessional Education Committee, where she advocates for PFCC education for all health professions, students, and faculty. Thank you guys so much for joining us today. I won't take up too much of your time because I know you have a wonderful presentation prepared. So without further ado, Dr. Bloch and Linda Starnes.
Thank you. We're thrilled to be here. We have a poll for you guys to fill out first, and I think it's showing. If you guys could do it, we really just wanted to know our folks and who's in the audience. So please fill it out, and you can advance the slide. Thank you.
So far, lots of family members and lots of hospital-based with a nice scattering of everything else. Oh, allied health providers. Cool.
Wow.
Yeah.
Okay. We're still getting those votes in. Hospital, family, 16, okay.
Okay. I think most people have probably weighed in now. Slowing down.
We have 42 out of 55. Everyone get in and we're almost done. Okay. We have a minute left. Let's.
I also just wanted to mention that if anyone has any questions, they can interject throughout the presentation, I believe, if our presenters are okay with that.
Absolutely.
Okay. And then I will also be monitoring the chat. If you don't want to interrupt, I will find a time to ask questions of our presenters when it's convenient.
Well, if it's okay, Elise, in the looking at our time and wanting, we'll let that poll grow a little bit more.
Yes, sounds good.
And people keep kind of stepping in, so we'll
absolutely go right ahead.
But just want to thank you guys. This is going to be a discussion. You all are kind of our big old focus group, chatter group, and we're learning together. But we're just going to do a quick overview of the patient and family engagement, PFE, as you will see it in many places. Have our quick breakouts for either youth discussion or patient and advisory council discussion, and then come back and pull it all together. And we're going to do some resource sharing. So if you know you have a resource that speaks into either of these topics, please get them at the ready to share on chat and share links and information.
Okay, you can advance.
So we're going to ask you all to be active on chat, just like you've been doing. That's not very hard for this group I'm finding today. So it's terrific. But so when we talk about family, and when it comes to pediatric health care and we want to just get your sense of who do you view as family, or when we talk about family leaders, who is family? So if you will tag in what you think family means on chat. Can mean. See if we get anybody putting in there. Oh, Angela, you're a ringer. Oh, that's all. I love this. So it's anyone who has a vested interest in an individual. It's what the family defines itself as being. Those who live in care with a child, caregivers, siblings, whoever you define it as. So, you know, all the above. You know, and again, we do not want you to forget about guardians and our foster care families. Also, it's who the patient might decide. The patient gets to say so if they're in a patient scenario. So that's great. All right, we're going to switch gears now. The next one is going to be when we talk about youth, and there's a lot of words that get used around that term youth, but we just wanted to kind of frame things just a little bit. Adolescent, teen, young person, emerging adult, the young adult, all of those kinds of words get bandied about. But the World Health Organization and UN define adolescence as between 10 and 19. Youth are 15 to 24, and young people, and that term is used with the World Health Organization and the UN, they are 10 to 24, that whole range. Our Health and Human Services Department and Department of Ed look at youth as 10 to 18, sometimes up to 21. We're going to come back to that. Our age of majority, as most of you all know, is 18 years old. We are in the adult classification at that point, as far as just law is concerned, age of majority. And then services for children and youth with special health care needs. This, in talking in the healthcare field, but sometimes in the education field too, it can go up to age 21 or through 21. Our Affordable Care Act allows for service up to 26 years. So there's a lot of ways to look at that term and those ages. The other thing that we all have probably bumped into is that it varies upon clinician and hospital system as to what that age is that one moves out of the pediatric care system and into the adult services side. And it can range anywhere from 18 to 26. Depending on the physician, they will even allow for our young people to stay into adulthood. And so those are all things that we talk about when we talk about youth. Last thing, and this is going to be another one of those chat moments. When you talk about diversity, what does that mean to you? When you think about, we want diverse voices on our councils and focus groups and other kinds of engagement activity, what does diversity mean to you? Okay, race, age, ability, array of medical needs and abilities.
Right, reflecting the populations, the areas where you live to make sure it's representative. Great.
Different roles.
Right. Good. Okay.
All right. Gonna throw out just a couple of others. Don't forget the siblings. So I'm gonna throw out some others for you to think about too. When we talk about origin, heritage, ethnicity, language, gender, physical appearance, your educational background, geographic location was mentioned. Matt, good. Socioeconomics, creativity and non-creative. Yep. Your faith background, your political views, there's all life experiences. So all of those things wrap in. Different kinds of communication.
Right.
Thanks, Nancy. Thank
Great.
you. All right, so now we've got to set the stage.
Okay.
Thanks.
Okay, we're going to move on. Next slide. So you guys can also chat in here. Here are a few reasons. We're all here because a lot of us have either had children with special needs or are working with that population, and they are the most important stakeholders, and they eventually will be grown adults and need to be part of this conversation. And we want to look at, and Linda's going to be chatting with, how can we more involve youth in FFLN and other organizations, and how it can empower them. And we'll be learning about what you do. I can tell you, in our Youth Advisory Council at the hospital, they are involved in decision making. It's who they are, and we all know that when we are involved as stakeholders, it is easier for those decisions to be accepted, adopted. We are part of the process, and all of us who've worked with youth with special needs and they're involved in systems, they get to learn about themselves and develop empathy and learn about others. And this is the type of engagement we need at all levels, at all systems, at all community or partnerships and organizations. Linda, anything else you'd like to say?
No, just other than we got this information off of HHS's website in their Administration for Children and Family Services. They have a really great section on youth engagement. So, and that came from there.
Okay, and I believe now we are going to split. You can go to the next slide. And I believe it's, yes, we're going to join breakout sessions. And then what's going to happen is we're going to be talking individually for about 20 minutes or so. And then we're going to come back as a group and process what we've learned and have some take-home messages and what's the next step for us at FFLN. Okay, okay, are you guys singing Coming Back Together?
Yep.
Okay. Woo, that went fast. So we wanted to just chat about, if you guys could chat in your.
We just see your screen with your.
We don't see the video. Or the,
Yeah.
Okay,
we don't see the.
One sec. Thank you. 1 minute.
We were seeing how organized you are with all your files, though.
Okay, well, that's good. Let's see if you see it now. Are you seeing it now?
It's start.
Yeah.
Yes.
There we go.
Coming back together. Yes? Okay. Thank you, guys. It's wonderful to have such help. So we wanted you guys in the chat to just talk about the take-home messages you got from the youth group with Linda and from the PFAC and the edge of COVID from me. But some things that we really wanted to chat about first is, and just put on everybody's radar, is that we want to increase the youth, and I'm going bottom up actually, but increase youth involvement in the FFLN. They're the future. We want them to be self-advocates, and how can we do that? And then we know that, advisory councils are the end external users. Their patients and families are in the hospital. They're why we're doing this care. So why can't we have advisory councils for all organizations, not just hospitals? And those of you who are in different community organizations, is there an opportunity to do that? The other thing that I'm going to share with you a little bit more, but just so you know, there is one state out of 50 that has a law since 2008, Massachusetts, that says every hospital in the state must have a PFAC. And I'll be sharing about that in a minute. And also we thought about, do we want to form a coalition with disability and advocacy groups to have some sort of advisory council for our legislature in Florida for health and education decisions regarding youth and children with special needs? What would that look like? Is that something we want to do? Other places have done that. And what other things have been pulled up in the chat? So I just want to share a little bit about this, and we gave you some resources. So this law came into effect in 2008. And these are all the wonderful things that's happened. But because of this law, the bolded, they have a PFAC advisory board in 2014. So that they have 20 representatives from PFACs across the state. And when I look at all the things they've done, you think about how they've increased the health literacy of those families and patients from these opportunities. And it's a coalition, a statewide effort to get everybody together and to improve and work towards best practice. And I just think that's really incredibly exciting. And is that something we'd want to do? I don't know. Just a thought. So these are just links to the Massachusetts thing, and I'm going to show them in a minute. Let's see if I can show them easily here. 1 second. I'm going to shut this down. Okay. Okay, so this, okay. I had it up before. And okay, so this is that website for the Healthcare for All, which is this Massachusetts Massachusetts advocacy organization, and they have annual PFAC reports, and they give a report on the state. So I think that's really kind of exciting. This is just information about their experience and what they've done. And, you know, is that something we're interested in doing? I don't know. Do we need to limit it to hospitals? But it's just something to think about. Okay. And current slide. Okay. Okay. So what have folks, I'm gonna stop. What have folks thought about in terms of their take-home messages? What's written in the chat?
There's a great question in the chat that I also shared from Dawn Baker. She was wondering if there was published data on the impact of healthcare outcomes in Massachusetts on the impact of that PFAC law, and wanted to know if that might help with funding opportunities for parent and family leadership.
I looked on their website, but we could contact them. I'm sure, you know, it's been since 2008, but their reports have been since about 2012, I believe. And in answer to your question, we'd have to look, but that would be really interesting to find out. But just on a larger level with the impact of PFACs, you guys might be familiar with the HENS, Healthcare Engagement Networks, and they have connected patient and family outcomes to reduce costs, reduce medical errors. So that's been a Medicare initiative through the ACA that has demonstrated there's 5 things they look at. They look at, do you have a director of family centered care? Do you have an advisory board? Do you do check-ins and prepare people for surgery? Do you have a patient family advisor, a person on your executive board of the hospital? And there's one more, and they have linked those to errors, to reducing medical errors. I know, so that's already in the works, and there's lots of information on those on the Medicare website, the innovation money they got from the ACA. So that stuff is there. Good question.
That's
And
very
I'm going to just say that I would parallel and think that if you are seeing positive results and positive movement in the hospital systems that have patient and family advisory councils, it's an extrapolation. I get it. But I would think that there would be as much positive momentum in other kinds of systems in our public health system and other organizations that want to embrace this perspective.
I had a question. It kind of came up in the chat, and I don't know if it was this group or the other one. I know that since year 1, I think, it's always been, we need to get them more involved in the FFLN. And I guess my question is, like, what are the steps to make that happen? Because I think I just saw Angela posted in the chat, you know, we do rely on members, kind of word of mouth, but then I noticed that Debbie had posted at some point that sometimes it's a matter of people either not knowing or just kind of getting the youth there and them not feeling comfortable or whatever. So what do we need to do better or differently to really engage and bring them to the table with us?
Angela, do you want to take that first, or shall I weigh in just a bit?
You go ahead.
Okay.
I'm thinking of my next thought and framing my next question actually for everybody.
Well, I will say that, you know, we are a new, when you think about the age of this organization, we're new. And in all honesty, I think we have grown a tremendous amount and with a lot of strength. And this has been mentioned, but not been a focus yet. And so this year was our time to throw it out there a little more formally, try to build some thought behind that. None of the organizations that were represented in our chat, no one mentioned that they had any active type of engagement of the youth voice in their organizations, which tells me not a lot of people are doing it here in Florida. But there's a lot of information. AMCHIP, the Association for Maternal and Child Health Bureaus, they just had their annual meeting in August. I would say a third of that large annual meeting was focused on youth engagement, youth partnership, and the last keynote plenary session was all youth speaking, and this was healthcare related. So it's going on. It's going on other places. It's just how do we start to build the processes for adding this in to FFLN?
And I would just add to that, Linda, that you know, I was also heartened at AMCHIP, or heartened in one sense, and then thinking, oh, you know, how can we do more of it here in Florida? And it comes back to a little bit of what we talked about in the breakout session, where, you know, you kind of need to find just like everything else, you need to find the champions. You need to engage with them. You need to engage with them on their level, and you just need to start small. And I was reminded again, as you were asking that question, about something that came up recently at another conference that I was at, where I was presenting on the FFLN and giving the numbers and being happy about how we have grown. And somebody chatted in a question asking me about the race and ethnicity makeup of the FFLN. And I said, gosh, you know, I said, I've never actually asked that. I was just happy to have family leaders, champions, and emerging professionals. I didn't care. And I totally understand why somebody asked that question.
Right.
But, you know, for those of you who were there back in 2016 or even in 2018, we were thrilled to have 30 family leaders in the room and, you know, 20 champions. And so again, we're growing and evolving. And I think somebody mentioned very early on, or Pam Kissendall actually mentioned at lunchtime, about having patience. And I had to learn to have patience. Generally a woman in a hurry. So we'll get there. We'll get there. But we'll get there with all of you. I mean, the network is about all the people who are here today. I'm not the network. You are. And so when people talk about, and the FFLN isn't its own entity, you are the FFLN. And so it's going to be the tiny steps that we take with all of you, adding, you know, getting a friend for Max Starnes to come to the FFLN conference with.
That's right. Well,
Thank you,
and I
Andrea.
want to mention a brand new friend of mine, Megan Mazzell, who is online with us from Michigan. She and I are on a cohort together with AMCHIP, the Family Leaders cohort with their Leadership Lab. And Michigan does have a lot of nice stuff going on up there. So thank you, Megan, for chiming in. And I suggest you go and check them out. Go Google for them. And then also she had mentioned, if you are not aware of Got Transition, they are the gurus to all things healthcare transition. And that was mentioned. So we're,
I was also thinking, you know, YACs could be youth advisory councils, those students, and I was thinking of Office of Disability Services in universities. That might be a nice place to reach out, because the students who identify there, and if you explain to them what we're doing, you know, there's different ways to reach out, or different disability group organizations that the youth might be involved with. But the personal touch, you know, most of us get connected through these things through someone we know. So, you know, if we know people, kids in YAC and they're going on, can we encourage them to be involved? I think it's like a multifaceted approach to get the youth more involved.
It's going to be a marketing and personal touch approach. And so this is we're gathering data here. And so we are going to be utilizing that, and would love to have a few folks who have a real care and concern and passion about this to come along with us, and we'll see what we can figure out.
Right.
I just wanted to just share briefly something that's happening here in the county with racial equity, advancing racial equity. Child welfare groups and also domestic violence groups have started listening sessions to assess what are the specific barriers for people of color interacting with the system, right? So that's an idea that's creating a lot of engagement, a lot of discussions, because it starts with training on equity, health equity. Sometimes we do not know what that look like for people of color, right? I'm a Hispanic, so I should know, but I can tell you that it's very different from equality. So just wanted to mention that.
No, that's a great point.
Yeah. And I'm looking, Florida Sands, that's some younger people and maybe older people too, that's an advocacy group for people with disability that got mentioned in, give a reason for it. Also, I will say that our foster care system requires youth engagement on council. So that's another group that we could look at for information.
So,
I know I spoke. Oh, I'm sorry.
no, go
I
ahead.
was just going to say, I know Angela and I spoke last year about my son, and she said, of course, this was pre-COVID. Next year I want him, at FLN, and he can have his own room, whatever. And for him, at least, he's 19 now. Trying to engage him in something is figuring out what's going to make him want to do it. When he was on the ESC Advisory Council, he came up with this idea that he wanted to be called Dr. Jeremy Kaiser, like the ESC, director's name, was a doctor. And so they made his label, like his name label, that, it got him engaged to want to do it. Right now, his thing is he likes to build, websites and Facebook pages and things. So maybe that would be a way of going, hey, FFLN needs a Facebook page. We need someone to help with that. Just like Mac did the pictures last year, finding them something that they're
Meaningful.
Yeah, something that makes them want to be in.
Something that's meaningful.
And starting with our families, we're already here, right? So we've just got to figure out what triggers them to get them involved.
That is a great point. That's a great point, Paula. Like, yes, polling our own youth and seeing what would be the turning point for them to become involved with this. That's a great point.
Absolutely. There are a few questions in the chat that I think are interesting that I'm seeing. Lisa Math has asked, is there any way to get the schools to give students on the YACs to get school credit towards graduation, which would sort of be a win-win? And then there was also a question for Mac, that's a separate question, that would bringing a friend with you have made you more likely to attend an event like this when you were a teen?
I know we were involved with the ESC Advisory Council. Well, I still am, and I had Jeremy involved. And we didn't ask for the student credit, but we were just trying to get more staff involved from the district level, more teachers, people that were on the front lines involved. And we were just even, as parents, we were asking the school board to, provide trade hours or something for them, some reason for them to want to come volunteer their time. And it was a struggle. They didn't want to give anything up for their willingness to be involved. So yeah.
So that's what we were talking about, the barriers, and we would need to think about having to work through those hurdles and find the opportunities that would make, and Youth Move, we had that, thank you for mentioning that, Bright Futures. It's school system to school system makes the determination of what you get to utilize for those volunteer credits.
Right.
So that would be, you would petition to your school system, but that would be something, but we will give it to you later. I'm happy to share out some information, but there's a lot of advantage for being involved in youth councils that the youth benefit from, as well as all of the rest of us. Resources, Elise, do you want to tell about your?
Sure. So what I did put up was a couple, and let me just switch off. But the first one is from that Healthcare for All from Massachusetts, which has 1 million PFAC resources there. And then I didn't know, let me just, oh, I'm sorry. I didn't know if people were aware, wait a second, of PFCC. Oops, one sec. On PFCC has Connect, which is actually sort of like a listserv. I'm going to share it. a listserv, and it's right here. And and this is patient and family folks from all over the world, actually. And you can connect and chat with folks from all over about anything related to patient and family center care in the hospital settings. So this is a great networking. One of my students was looking at doing a kangaroo care family center care program in the NICU, and she reached out to see what people were doing all around the country. So it's a really wonderful resource. This is the resource page from the Massachusetts Healthcare for All, which is that community advocacy. So if you wanted to start patient family place in your facility youth advisory councils along with the Institute for Family Center Care. And I have this one. Did you want to chat about this one, Linda?
Well, that just was one of the, if you could just throw up the PowerPoint again.
Sure.
The youth.gov has a lot of information. AmChip has a lot of information. And I'm trying to remember what was the third one that I put down. But anyway, so again, Angela, these slides will be available later.
Yes.
Yeah. So
And
go to that resource. SAMHSA probably, yep, has some. Doris, you said you had your hand raised real quick before they chime us out.
Just quick, and thank you. I have a question. I have a child who has more involved medical needs, and probably for him participating and advocating is going to be more difficult. But my oldest son, Alejandro, he's his sibling, and he is very in tune with his brother. And very often I find that he has a very different take on things about his care that I don't even see, and he's seeing as a young person. Are we considering to include siblings for those cases?
Absolutely.
Who is family?
Absolutely.
Who is family? Cousins, aunties, uncles, grandparents. Yeah, so that's family. And yes, those youth level family members that have that sibling experience is very, very much.
That's another perspective that is critical, you know, and supporting those siblings. As Linda said, yes, absolutely. That's a great idea.
Yep. Friends that just have a passion for this as well. Yep.
Right. And you know, it's so funny because teaching at the university for years, most of the folks that we get applying to OT, PT, nursing, they've all had, a lot of them have had a sibling with special needs. And now it becomes, like it is for us, a labor of love. It becomes a labor of love for them. So those, you know, you're just molding these kids to give back and to become involved at an advocacy level. And what a wonderful gift that is. So, you know, as Linda and I were chatting about this, we're thinking, you know, what would we want if we had a magic wand for the future? You know, wouldn't it be wonderful if we had an active youth advisory board that was consulting and being heard by the state legislator along with all of us to make healthcare better and education services for our children and youth better?
Good dream.
Yes, the slides will be made available. Angela just nodded her head. They will be. Thanks. Okay, we need to run. Thank you guys.
Thank you all.
Get in touch. We will send stuff out.
Perfect. And we're going to see everybody at 3:30 right now in our Systems of Care approach, advancing equity and cultural humility and working with families experiencing medical complex issues next. Thanks for joining. Thanks for presenting. It was a wonderful